Good morning, this is Julie, a student nurse from UTS. Bed 14. Tobias Greenwich is a 10-year-old boy under Dr. Jones. Patient had a closure reduction of fracture on right ulna and application of plaster at Paris and also repaired the fracture of right orbit yesterday. Patient doesn't have any previous physical or psychological history. Patient Tobias transferred from recovery to the ward yesterday, so now patient is alert and cooperative. Vital signs and neurological assessment are within patient normal range. GCS 15, respiratory rates 26, 96% of saturation in room air, pulse 95 and temperature 36.5. All assessments have to do every hourly. Feeling of needling were found on right side with pale color at 3 o'clock this morning, but it's all settled down. So neurovascular assessment are also satisfactory. Paracetamol 500 mg prescribed for pain management for 6 hourly. Patient has difficulty to swallow a big tablet, so when you give a medication, it's better to cut it half and ask the patient to take one by one. And in the medication chart, ampicillin is written in the allergy reaction box, but the doctor wrote in the operation report and progress note that patient Tobias doesn't have any allergy. So please make sure the correction of allergy and ask the doctor to review and rewrite medication chart as soon as possible. Patient also have IV therapy of 0.9% of sodium chloride and 5% of glucose right now. IV cannula site is intact and stable. There are no signs of infections. Patient complained about pain around cannula site when he moves, so I use a tape to make it stable. So you should check the cannula site as well as sign of infection every hourly. And also please don't forget to write down patient's fluid intake and output. It's really important. Dressings on right side of eyes and plaster of Paris are all intact, dry and clean. There are no signs of infection or oozing or swelling. It's been all good. Patient shows depression and anger because of pain, 3 out of 10, but it's all managed by medication paracetamol with good effects. No pain reported by patients. But if the patient shows depression and anger frequently, we need to consider psychological status of the patient because he's only 10 and ask the psychologist to visit the patient. Tobias' own hygiene is well managed by his mother. And also they have issues between family. His mother was trying to contact with his father, but he wasn't answering the phone yesterday. So I called him today and told him about the patient's condition and situation. So he said that he will be here around 12 o'clock today. So I booked a meeting with social workers at 12:30 to discuss Tobias' further nursing care and discharge plan. Have a good shift. Thank you.